on the call today that are looking for resources. So with that, we'll go ahead and switch to Dr. Ibrahim Elsharkawi, who will be talking about developmental and rehabilitation therapies and mitochondrial disease, PT, OT, speech, and beyond.
Good morning. Good afternoon, everyone. I'm going to assume you can all see my screen okay, unless anyone says otherwise. Good afternoon. So my name is Ibrahim Elsharkawi. I go by Ibi as well, and I'm a metabolic geneticist and pediatrician who recently joined the faculty at Mount Sinai. I have no financial disclosures for this. So I'm going to start by talking about what, why, and where, kind of to give an overview of these developmental therapies that are so important to many children and adults as well that we see with genetic conditions, but specifically as it pertains here to mitochondrial disease. So I'll be giving a quick overview here about physical therapy, occupational therapy, speech therapy, and a little bit about physical medicine and rehab, and now how all these things might be helpful to someone with a mitochondrial condition. So physical therapy, this is therapy to improve mobility, function, balance, big picture, gross motor functioning. Occupational therapy specifically teaches you how to adapt to activities of daily living, how to eat by yourself, how to use the bathroom, how to go about your day doing the things that you need to do and that you like to do. Speech therapy focuses on optimizing language and also feeding and swallowing disorders. So speech therapists do a little bit of both. It's really focusing on kind of oral intake and language as well. And then physical medicine and rehab we'll talk about briefly some more in a little bit. So why do we need these things? Why are these things important? Why are we always recommending them? And it's because these are the indications. There are many, many reasons to get some of these therapies. Some big examples in mito include global developmental delays or developmental regression. So if you're not meeting those milestones or you're losing those milestones, these therapies are a great way to kind of reach your potential and improve. Hopefully, the goal is to improve functioning over time. As you all know, metabolic strokes or acute neurological regression, if you have Leigh syndrome, it can occur in mito. And these therapies and these providers play a big role in helping with the recovery or rehab phase following these events. If you have changes in your baseline functioning, in what you can do, if you're not able to do what you used to be able to do a few years ago, these therapies may also be helpful. And then issues with oral feeding and swallowing. You know, at every mito visit, many mito providers will screen for are you choking or coughing or gagging while you swallow, or is there anything to suggest that your swallowing isn't as coordinated as it used to be? These therapies can also help with that. Where does all this take place? So most often in hospital settings, right? It can take place through early intervention if you have a child below the age of 3. It can take place through local school districts and systems. And then it can also take place in private practice settings as well, generally. So a little bit about physical medicine and rehab, because before I did residency and then fellowship, I actually didn't know too much about this. But physical medicine and rehab is a specialty. It's a medical specialty. So they're the physicians who train in this. And what these docs do is that they really specialize in kind of coordinating and centralizing all these different therapies. So they help with access, assistance, and provide kind of a centralized platform for a lot of these therapies like PT, OT, and speech. But more than that, they also are able to provide medical treatments for things like neuro rehab following a stroke. If you have tone issues, they can administer Botox, for example, which some people find helpful and some people don't. They're the experts in assessing what your equipment needs are, what kind of shoes, what kind of wheelchair, things like that. And I refer my mito patients to PMR following metabolic strokes or acute regression to help with overall neuro rehabilitation and neuromedications. As you all likely know, the recovery from a metabolic stroke can take time. It can take many months. It can take years, and it's a slow. The progress can be made, but it has to be slow and steady. So what are the benefits? So if you're anything like I am, you might get frustrated with not seeing results quickly. I and many people I know are like me, want to see results as soon as possible. We're anxious to see something get better. Unfortunately, physical therapy, speech therapy, occupational therapy, rehab, all that stuff doesn't quite work that way. It is phenomenal and long-term if it is sustained, if you do it the way you're supposed to do it with over multiple sessions over a long period of time. We really do see phenomenal results, and we do see progress. It doesn't take place overnight. But the benefits are we can certainly see some developmental and functional progress to meet full potential. So I say that because none of this is magic, right? If you have developmental delays or developmental regression, in very rare cases will you get back completely to where we won't get you to where we absolutely want you to, right? To an ideal scenario. But whatever your potential is, whatever you can do, if you develop the skills and the exercise tolerance and the balance and all of that, therapy will get you to that potential if it's sustained. It can also help with your activities of daily living and assess what you can and can't do safely. And it can also identify subtle deficits. So all mito providers do a neuro exam, and we're all trained on how to do a neuro exam and how to catch deficits. And when I say deficits, I mean things that are maybe lacking a little bit and not where they should be from a neurological or functioning standpoint. For example, left arm weakness or left foot drop, things like that, subtle things like that. But there's nothing, I can't tell you how many times I've seen a physical therapist, occupational or speech therapist catch something that other providers aren't catching, not because they're not excellent at what they're doing, but because these providers, the physical therapists, the occupational therapists, and the speech therapists, spend a lot of time with your child or with you. And they can often see things, and this is their area of expertise, and they can often see things and notice things while they're still kind of flying under the radar. And then the other thing that I've recently started to think about is how these therapies may also contribute to our overall knowledge of mitochondrial disease. And this works kind of twofold. So if you do regular physical therapy, for example, at an academic center where they're doing the same thing over and over again at different intervals at different times, that develops a benchmark for what your baseline is and how your disease changes and how it affects your activities of daily living, how it affects your functioning. So this may be valuable as an outcome measure in clinical trials. So, as you all know, historically, some of the reason that we don't have FDA approved therapies or we haven't had much clinical trials up until recently is because we don't have a good outcome measure. Mitochondrial disease is very broad, and there isn't one thing we can look at where we can say with certainty that this goes down as the disease gets better or this goes up as the disease gets better across the board. And so physical therapy and assessing a baseline and having that be reproducible, that in itself can be an outcome measure that may be used in clinical trials. And then it also helps us better understand the natural history of many of these conditions. So this is a paper published by the team at the Children's Hospital of Philadelphia, where I did my mitochondrial medicine fellowship. And what they're trying to do here is that what they did show and what they're continue to work on is how physical therapy, when done at a center like this, can show reproducible results and serve as an outcome measure while looking at different domains of functioning, such as muscle strength, muscle fatigue, balance, exercise tolerance, dexterity. So it looks at all these different outcomes of functioning and in a patient, and they've shown that it can be reproduced reliably the next time you examine the same patient, assuming the disease remains steady. And there's certainly more to come. They're continuing to develop this further and further. I did want to thank the folks at CHOP. I did a one-year mitochondrial fellowship with these folks, and they were really incredible and taught me so much of what I know. And then special thanks to Jean Flickinger, the physical therapist at CHOP, who took the time to talk to me a little bit about this to help me deliver the best talk I can to you. I'm happy to take any questions.